My name's Bob Marlow, and I've been knowing Dr. Wilson now, I'd say about a year and a half. I've been a patient at the VA hospital for about 5 years, and my health kind of got deteriorated so bad that someone suggested I go see a neurologist. That led me to orthopedic, and that led me to Dr. Wilson. Well, I got to where I couldn't walk. There was something wrong with my legs. I couldn't put a lot of weight on them. I was having to get the crutches out. I was having a lot of foot and knee and thighs and low back and right side, and I assumed it was something wrong with my legs. But after I started getting the injections in my spine, my legs got better, and I get them every 3 months, and it does real good for about 2 months, and then it starts getting, it's not as good as it was, and by the time the 3 months is up, I'm ready for another one. It's helped me a lot. I mean, I can't climb trees or anything, but I'm a lot better than I was. I don't use crutches. I use supports and a walking stick occasionally, but I'm a lot better than I was. I was in service and I had some injuries about 32 years ago, but I pretty well overcame them, I thought, till about 6 or 8 years ago. They started flaring up on me. And I also supposedly had childhood polio. Well, after seeing the neurologists and the neurosurgeons, I supposedly never had polio. I had a brain injury. I had encephalitis to the right side of my brain, and I got maybe a stroke. And I got pinched nerves and bad disc in my neck. I got problems with my thoracic spine. It's got spurs on the inside that they think I could saw a couple of ribs out if it got bad enough. And I also have a bent tailbone, along with several other little problems. A lot of it's to do with how well you maintain yourself after you get an injection. If you'll take it easy for a few days and give it time to take its full effect, and then just because you're feeling good, still don't, overdo it. It seems to work pretty good. I mean, a lot better than it does when you feel. I'm kind of fella, if I feel good, I want to do more, and sometimes I overdo it. But I'm learning. Well, I don't take as much medication as I did. I still control my pain with hydrocodone and muscle relaxer sometimes. But before I started getting the epidurals, all I could do is take enough pain medicine to where I didn't feel hardly anything. So now I don't take the medication that I was taking, and I don't take it till later on in the day. Well, I'm going to give him the tops because he's the best. He spent more time with me and talked to me and seemed to be more concerned than anybody I've ever been around. He seems to be real concerned about how I'm doing, if I'm overdoing it, if I'm taking too much medication and all. So I'm here to talk because I think he's a good guy, and I think he's got my best interest in mind. Mm-hmm. And I believe he's a good guy. I mean, he might. A lot of times, people's first impressions are not right, but in this case, first time I met him, I knew he was a good fella, and I haven't changed my opinion one bit. I like him as a person besides a doctor. Shoots the junk with you a little bit. It ain't dead serious. I got to go, got a person in the next room, that kind of attitude. And he just relaxes.